We'd like to thank all of you for joining us for our Health and Safety Town Hall for August 9th, 2021. We've got a lot of folks joining us. We just jumped over the 100 mark there. But do want to thank you all for taking the time on this Monday afternoon to join with us for this Health and Safety Town Hall. It has been great to see the campus come back to life again, although it was certainly alive all summer. We had one of the most active summer camp programs that we've had really in our school's history over this past summer. And it has been great to see the faculty and staff come back on campus, to see students and parents come back on campus. I think if I opened the door behind me, you'd see middle school students getting their lockers ready for school on Thursday. But it's so great to see the campus come alive again. You know, and of course, we all hoped, based on the progress of the spring, that would lead to a reduction in COVID restrictions for the start of school this fall. But unfortunately, you know, we know that the Delta variant has had other plans as far as that goes. And that has meant that our Health and Safety Committee has been working diligently over the summer, meeting multiple times a week over the last several weeks to really help us prepare for the start of school this year in a way that's, you know, different than what we were anticipating in the spring. And I'm certainly very proud of the committee, of the Health and Safety Committee, and their efforts to keep everyone in our community safe. I told the faculty and staff last week on Thursday when they all came back how proud I am of this community and the way that we responded starting in March of 2020. And I certainly want to single out the Health and Safety Committee for their efforts to keep us all safe. And you see the names of all those people here. And I also want to recognize the medical professionals who've also, in our community, who've also been advising us really since February of 2020. And we take their advice and guidance very seriously. And we've also been partnering, as you know, with the COBB Department of Public Health along the way. And I'm just grateful to this team and to those people for their help in guiding us. Today in the town hall, if you have questions that you want to submit, please submit those to the chat section. Michael Arjona, our Assistant Head for Academics, will be monitoring those questions in the chat. So please feel free to put those in there as we share this information during the town hall. And really, without any further ado, we want to get right to it. And I want to turn it over to Emily Adams, our Science Department Chair and the Innovative Teaching Chair at Walker, who's been a real blessing to our school and her role in helping guide our Health and Safety Committee. Emily?
Thanks so much, Jack. So first, I wanted to just walk through a brief refresher about what we've learned about COVID-19 since March 2020 and highlight how some of those changing realities are influencing our strategies. So we now know that COVID-19 is spread through droplet transmission, which is larger droplets that are about 6 feet or less in distance, but also that there appears to be a reasonable role for aerosol transmission, which is smaller droplets that can travel farther. We also know that surfaces aren't really a player in transmission of COVID-19. So while it's important for excellent general hygiene and other diseases, we know that that's not a major mode of transmission. We also know that lower risk situations for transmission involve physical distancing, involve outdoor or well-circulated air, and higher risk situations are those where we have more stagnant air and we have people closer together indoors. As a reminder of signs and symptoms of COVID-19, these can appear anywhere between 2 and 14 days after exposure. With Delta, we're seeing that symptoms are starting about a day to a day and a half sooner than they have with previous variants. And also, we're noticing, particularly in pediatric populations, that it will often present as more kind of generic head cold symptoms, although we are still seeing some of the things like new loss of taste and smell. So I want to talk briefly about what the data looks like in the county, in the state, and how Delta is influencing the level of cases that we're seeing. So as of today, the two major indicators that we look at locally in the county are the cases per 100,000 people per 7 days. Anything over 100 cases is considered high transmission, and you can see that Cobb County is now at 322 cases. We also look at percent positivity. So out of the people that go to get a COVID test, how many of them are actually positive? In order to really slow wider community transmission, we want to see that number be 5% or lower. And Cobb County is now above 12%. As far as Region N, which is the hospital region that we look at and where our hospitals are in Cobb and Cherokee County, we're now seeing over 20% of the cases in the hospital being COVID related. To contrast that, early in July, that number was down around 2%. And we're also seeing our ICUs being utilized at increasing capacity across the board. When we look at the state of Georgia in the pediatric population, since July 3rd to August 6th, you can see in the middle of this slide the percentage increase in pediatric cases from 0 to 4 all the way up to 16 and 17. And what I'd like to point out is that for our kids 11 and under, those case counts have gone up by over 1,000% in the last month. And we know that Georgia as a state is not as high in vaccination coverage as we would like it to be. Cobb County definitely has higher than the state as a whole, and we'll talk about Walker's vaccination coverage in just a moment. So that status in the county, combined with what we know about Delta, we know the Delta variant is twice as transmissible as the previous circulating variants. And we think in part that's because it has a higher viral load. So basically the virus its shape is now stickier on that spike protein. So it's easier for the virus to attach to our cells, get into our cells, and replicate faster. As a consequence of that significantly higher viral load, they are finding in a variety of studies in the UK, in Scotland, in Israel, in Massachusetts, that even vaccinated people can carry a high viral load and transmit the virus, even though they might be not showing symptoms or have very mild symptoms. So we are going to have resources on Walker's FAQ page about vaccines and vaccine safety, as well if we don't address your questions today. So one of the things that I'm thrilled about is our vaccination status for our Walker community. So as of the end of last school year, over 90% of our faculty and staff are fully vaccinated. And just as a reminder, fully vaccinated means 2 weeks after a 2-dose vaccine like Pfizer or Moderna, or 2 weeks after the single dose of a vaccine like Johnson & Johnson. We also know that for our students who are eligible for vaccination, over 80% of those students have received at least 1 dose of the vaccine. And again, when we compare that to Cobb County or the state as a whole, that's pretty phenomenal. So you've heard about breakthrough cases, I'm sure, and the vaccines aren't perfect, but they're great. They're really excellent at what we want them to do. The goal in the pandemic is to prevent serious illness, hospitalization, and death. And the vaccines are continuing to do a phenomenal job at that. Because of the change in the Delta variant, we are seeing increased symptomatic cases and asymptomatic cases in vaccinated individuals. One of the things that I think is helpful for context with, well, how common are those breakthrough cases in Georgia? So this is data from Georgia, and it's from January to July 27th. So it includes some Delta data. And you can see that on the left-hand side, in our Georgia state population of individuals over 6 million who are not fully vaccinated, over 300,000 tested positive. Thousands were hospitalized and over 9,000 unfortunately passed away. In contrast, if we look at our vaccinated population in Georgia, over 4 million individuals fully vaccinated, only 4,900 individuals tested positive, 118 were vaccinated, and unfortunately 24 passed away. So when we hear about breakthrough cases, it can sound scary. But I think that this data is reassuring to me in particular that it's happening. We know it's going to happen as the virus evolves, but it still provides excellent protection for us. So we are constantly following what's going on with this virus, what's going on in the county, and we use a wide variety of sources to protect our community as best we can. So I just wanted to take a minute and tell you briefly some of the sources that we're using. And again, our goal at Walker is to have our students have the full Walker experience as safely as they can. And that means getting them to collaborate and build relationships with their peers and their teachers and just be kids. And so that's why we're focusing on layering strategies to protect our community. So some of the sources that we've been following pretty steadily are the American Academy of Pediatrics, Public Health England, which has done a really phenomenal job of tracking what Delta is doing and what it looks like in different age groups. We use a variety of major journals, including the Journal of the American Medical Association, the Lancet, Pediatrics, and a wide variety. We work regularly with Cobb Douglas Public Health. We look at policy making experts from the Children's Hospital of Philadelphia, the North Carolina ABC Collaborative, states that are a little bit further ahead in surges than we are, to see how those schools have addressed that and what strategies are helpful and which strategies aren't. And we're tracking Georgia Department of Public Health data on a daily basis. So let's talk masks as we head into specific strategies that we're using at Walker. So from early learners to grade 12, masks will be required indoors for all students, staff, and visitors, regardless of vaccination status. And that is based on the recommendations we're seeing, the data that we're seeing. We are very conscious of having mask breaks for our students. We are trying to incorporate as much outdoor time as we can, having that circulating air, which we'll talk about more in a minute. And utilizing outdoor spaces for those mask-free learning opportunities, those socialization opportunities. And so that's kind of our goal there. Some quick reminders. Remember that masks need to cover the mouth and nose completely. Students should bring an extra mask each day, especially if they're going to wear masks that are going to get dirty or wet, because then that effective really kind of rapidly drops. Fit is really important. I have a rising 4th grader and a rising 6th grader at Walker, and I can tell you they both went through major growth spurts this summer. And when my youngest put his mask on, it was doing this business. So I think it's helpful if the kids have been at home and they haven't really been wearing a mask for a while, just have them try it on, see how it fits. They might need to go a size up. I like to use a mask company that comes in a lot of different sizes, so I can actually measure my kids' nose. So I'm really confident that they've got a good fit as they grow. So we are requiring masks on buses as well for all individuals, since that is an indoor environment. And we've had some questions about, are masks safe? I've heard that maybe for kids, they're not. And so I wanted to just quickly address that. The American Academy of Pediatrics continues to support the safety of masks for all kids, or nearly all kids above the age of 2, barring a few specific medical or developmental conditions. Several extensive studies have been done showing that there's no alteration in the level of oxygen that a child breathes in or out. That goes for adults too, that masks are safe even during exercise and other activities. They don't impact lung function. I know something potentially confusing is that at the end of June, there was a study released in the Journal of the American Medical Association that said, hey, these kids are holding on to more CO2 than they should be. However, 2 weeks after that study was published, it was retracted because of poor experimental design and the invalidity of the results. So all of the professional pediatric sources that we have, all the experiments we have really suggest that masks are safe for everyone. We do encourage you, if you have questions about masking or about vaccination, please reach out to your pediatricians. They know your kids and they're really well trained to be able to answer those questions. So the last thing I'm going to address before I turn it over to Christy is physical distancing. So in the classroom, we are going to focus on 3 feet, at least 3 feet for seating. We know that interaction between students and their teachers for collaborative learning is really important. So we might have kids be a little bit closer together for short-term learning activities or group social activities. But when we're seated more formally in a classroom, we're looking at 3 feet. We are really cognizant of those higher risk activities and things like dining. So distancing will be increased in those situations where children are not wearing their masks. So in the dining hall, students will have increased distance. We're focusing on 6 feet apart, particularly for those kids who are not yet eligible for the vaccine. We'll discuss ventilation more on the next slide, but we're really encouraging outdoor dining for grades 6 through 12 because we know outdoor air is excellent at diluting the virus. And so we really want to encourage that. And we've got lots of spots on campus for kids to eat together and socialize together outdoors so that they can have that mask-free time too, because we know it's important. In the lower school and primary school, we had some questions about what the dining hall safety situation looks like there. And in that environment, we're focusing on making sure that we've got windows or doors open. So in addition to our mechanical ventilation, we've got that fresh flow of air from the outside. And I will turn it over to Christy.
All right, thank you, Emily, and thank you, Jack. Just as Jack did a minute ago, I do want to thank the members of the Health and Safety Committee who have been so dedicated since this pandemic started. And also, I want to, just as Jack mentioned, thank all of the medical professionals who've been so helpful in guiding us, sharing articles with us, offering suggestions, offering recommendations. It has been very helpful. And lastly, one thing Jack did not mention expressly is that whenever, both last year and this year, as we planned our safety mitigation strategies and the plan for the school year, one thing that we've done is share our plan with COBB and Douglas DPH. Both years they've given us feedback, and I'll say this year they were particularly complimentary about our safety plan for the start of the school year. And it was really a blessing, felt like a blessing to me, and I'm sure to the other members of the Health and Safety Committee, because we have worked really hard this summer to make sure that we are keeping in mind the best physical safety for our students and also thinking about that overall Walker experience that Emily was talking about. So with that in mind, Emily mentioned 3 of the mitigation strategies, probably three of the most powerful mitigation strategies that we have at our disposal. One is vaccinations. And as she said, we were just thrilled with the rate of vaccination on our campus, masking, and the physical distancing. And then we want to talk about a few others of the CDC recommended mitigation enhancements here. And one of those is hand washing. So hand washing feels routine. I know we've talked about it so many times now, but it really is a way to keep our students and ourselves safe. So hand washing throughout the day will be conducted. We also have sanitizer stations throughout campus as well. But we want to be very deliberate, particularly with the younger students, and make sure they understand how to properly wash their hands. So we'll be doing some education around proper hand washing, about using soap and water, about making sure we get all the nooks and crannies, and about making sure we're washing our hands for a proper amount of time. So that will be something that's incorporated into our days and into our routines. Sanitizing, which really just means cleaning our surfaces in such a way that it kills the germs. Well, that is something that will also continue to happen here at Walker on a very regular basis. Desk will be cleaned prior to snack at the end of the day, and we'll make sure that we clean any spaces where there's been an unwell member of the community immediately, as soon as we have the availability to do so. That will be taken care of just right away. One of the systems that we use for cleaning is called a Genion sprayer. We have multiple Genion sprayers here on campus. We use those every single day to make sure that we've sanitized the surfaces around campus. Respiratory etiquette. So respiratory etiquette just means like simply coughing, sneezing properly, and that would be inside your mask. Don't take your mask off, and using, if you don't have your mask on, to make sure you use a body part and then you quickly, wash your hands or sanitize your hands afterwards. So that's something that we'll also be very deliberate about, particularly with our youngest students. Our older students start to get the hang of it. I think none of us love the idea of sneezing into a mask, but that's something that, that's the point of the mask. So that's something we help educate our students about. And then mechanical ventilation. Ventilation is particularly important in a school setting. As Emily mentioned earlier, as we've learned more about how COVID is spread, having proper ventilation is an important part of building safety. So that's something that we've spent quite a bit of time making sure we understand that we've maximized to the greatest extent possible. So we have added air filters or higher quality, larger upgraded air filters throughout campus. We also are flushing our buildings every night. We are maximizing our outside air, and in many of our spaces and in our school buses, we've added bipolar ionization, which is actually something that proactively cleans the air. So those are just ways that we are working to keep students safe and trying to use that layered approach. So another key layer in the safety strategy is making sure we're doing our contact tracing, identifying individuals who are COVID positive, doing our contact tracing, and making sure that we're properly isolating and quarantining them. So we're going to spend the next couple of slides talking about contact tracing, quarantines, isolation, and what that process looks like here at Walker. First of all, it is our definition of close contact is that same definition that we've used since the middle of last year when the CDC updated it. We're looking for situations where individuals are within 6 feet for 15 minutes or more over a 24-hour period, up to 2 days prior to the onset of symptoms, and then during their 10-day isolation period. So as a general rule, that is the definition of a close contact. That is what we're looking for when we do our contact tracing here on campus. There are some exclusions or some exceptions this year with the onset of the vaccinations, and also with all the study that the CDC and other organizations have been able to conduct during last school year about the school environment. What we've learned is that the school environment is actually a safer environment than just the general public. So the CDC added some exceptions for those close contact rules that we are going to talk about here. The first is a revised definition for students only in an academic setting. So this does not include any teachers. It doesn't include any parent visitors. It would have to be 2 students who are in an academic setting only. It would not include athletics. So really it's just in the classroom. So long as the individuals aren't 1 to 3 feet apart, then they would not be considered a close contact. So a close contact in the academic setting would be 1 to 3 feet apart for 15 minutes or more over that 24-hour period. And the second caveat to that is that both the infected person and the potential close contact would have to properly mask. So as long as they're properly masked and they aren't within 1 to 3 feet, then they would not be considered a close contact based on this revised definition by the CDC for the classroom setting. The other exception is the vaccinated individuals, and this is for adults and students alike. After you're fully vaccinated, and Emily talked to us what fully vaccinated means both for the CDC and here at Walker, then after you're fully vaccinated, you don't have to quarantine as long as you aren't exhibiting symptoms. There are some exceptions. You would need to wear a cloth face covering. The CDC is still recommending testing at day 5, but you would not have to quarantine so long as you're fully vaccinated and you have not started to exhibit any symptoms. And we talked just a minute ago about what that definition is for just that traditional definition that was listed on that page there. Then as we look at the quarantine and isolation guidelines, so isolation and quarantine are 2 terms that people often get confused. And so we just want to, first of all, just clarify the definitions. So a person would isolate if they are infected with the COVID virus. So if I'm infected, then I isolate. If I'm a close contact, then I would quarantine. So that's just a little bit of a definition so that we don't have any confusion from that standpoint. So if you have to isolate because you or your child has tested positive for COVID-19, what is Walker's policy? Well, Walker's policy is consistent with the CDC policy. COVID positive community members are expected to isolate for 10 days after first exhibiting symptoms or after a positive test if it's asymptomatic. If you're an asymptomatic infected person. So on the 11th day, so long as you haven't had a fever for 24 hours without fever reducing medication, and so long as your symptoms have improved, you're actually welcome to come back to campus. The fantastic thing about Walker is that we have this awesome COVID support team, and we have 2 nurses who are the heart and soul of that COVID support team. And there'll be lots of interaction, and they will help you understand when and if you should come back to campus. So quarantines, as we mentioned earlier, a quarantine is someone who is a close contact to someone who's tested positive for COVID. We just talked a minute ago about what a close contact is. We understand the general definition and those 2 exceptions. And in general, at Walker, if you are a close contact, then you must quarantine for 7 days, and you can come back on your 8th day so long as you have a negative PCR test on day 5 or after. As we mentioned, if you're fully vaccinated, you're actually free to continue to come to campus so long as you wear your mask for 14 days afterward, and so long as you don't exhibit any symptoms. Who to contact? So if you find out you're a close contact, if you start to exhibit any symptoms of COVID, if you had a test for something else, maybe for travel, and it turns out your child is an asymptomatic positive case, make sure you email walkernurse@thewalkerschool.org. I can't begin to tell you how important it is that we have that email address like plastered in our minds, on our refrigerators, on our desktops, whatever we use throughout the day to remind us of all the things we need to do, because it is awfully important. Anytime you have a COVID symptom, a suspected COVID case, or a suspected close contact, that you email walkernurse@thewalkerschool.org. So let's talk about what the contact tracing process looks like at Walker. First of all, we have multiple members of our COVID support team and our general administration who have done the Johns Hopkins contact tracing course. So we have a nice group of people who have taken this seriously and have gotten those credentials. The other really great news is now we have a year's worth of experience in contact tracing. And we have a very robust contact tracing process. And we have a fantastic COVID support team to help conduct that contact tracing, and then also to follow up with any isolated or quarantined members of our community after those have been identified. So, what happens? Normally we get a phone call, email, text message, and we find out that we've had a close contact, or we find out we've had a positive case on campus. And if it's a positive case on campus, then we initiate our COVID contact tracing protocol. We work through a layered approach to the contact tracing. And then, the important things are, if we find out there are close contacts, whether it is that they have to quarantine or they just need to be notified because they were vaccinated, then we do that. We'll make a phone call. Trust me, it could be relatively late at night, on the weekends. We want to let families know right away. So we'll actually notify each person via phone call, and we'll talk them through the quarantine process. We'll talk them through the COVID support team. We'll talk them through DPH recommendations for close contacts. And then we also identify all low-risk contacts. Now, low-risk contacts we haven't really talked about here, but one thing that we feel like is really important, and DPH has really encouraged us to do this, is to make sure anyone who is in the general vicinity of a COVID positive person, so that would be anyone who's in the classroom, or let's say you're at a practice, or let's just say that you're maybe there's some sort of after school club that meets, and you're in the same room or the same space as a COVID positive person, but you actually didn't meet that criteria for a close contact. You weren't within 3 feet or 6 feet, depending on the activity. Then we're still going to send you a letter. We're going to let you know that your child was identified as the lowest contact, and help you understand what the signs and symptoms are for COVID, and help you understand anything you should be monitoring at home. If you're a low-risk contact, you're free to come back to campus. We're not going to continue to follow up with you, but we would want you to notify us if you start to develop any signs or symptoms of COVID. And then lastly, we do notify the Department of Public Health. We are asked to do so. We let them know of anyone who was identified as a COVID positive case, and any close contacts that were identified. We also forward to them any positive test results. They ask us to do that at the time we disclose the positive case and the close contacts. And then they will actually conduct their own contact tracing to identify any close contacts that weren't in the school setting. Our portion of the contact tracing is entirely geared toward the school setting, and they're looking for close contacts outside of the school setting. So what should you do? Just don't be surprised if you get a phone call, sometimes a text, that's a notification late at night. We really work as soon as we get this information to complete the process as quickly as possible. And we want to let you know if your child has been identified as a close contact. Also, if you could cooperate with the COVID support team and with DPH, that'd be great. The COVID support team is going to have lots of really good tips to help you throughout the process as well. And then the two nurses will be maintaining contact with you, like I said, if you're either isolated or quarantined. So make sure you obtain that clearance from those school nurses prior to returning to campus. And okay, so a little bit of good news. You don't have to complete your school pass wellness screening each morning, but we are going to ask you to make sure you're looking at those signs and symptoms of COVID. Emily shared them with you earlier each day, and to do a temperature screening at your home each day before you come to campus. We did thousands of temp and symptom screenings last year. They actually weren't very effective. The CDC stopped recommending them during the school year, but we continue to do them. And so what we want to make sure we ask all parents to do is make sure you're not sending your children to school sick, make sure you're checking for symptoms, make sure you're checking temps before you send your child to school, but you don't have to do the COVID school pass screening. And then the COVID dashboard, we utilized that for much of the school year last year, just to let families know about any positive cases on campus. If you go into Walker Web, there's a resource board. There's one called COVID-19, and we will start updating that again on the first day of school. And now I'm going to turn it over to Michael Arjona. He's going to talk a little bit about the teaching and learning implications of isolations and quarantines.
Thank you, Christy. So we just wanted to highlight one key thing, which I know is a question we've already seen, which is what happens if my child has to quarantine or isolate because they're going to be out of school for several days, up to a couple of weeks. So what will they be able to do to ensure that they can keep up with their learning and stay engaged during that time? The basic philosophy on both will, across all divisions will be the same, but it of course will look a little bit different in developmentally appropriate ways. So in the primary, lower school, and New Avenues, the child's homeroom or advisory teacher will coordinate the opportunities that they have to continue learning. And in those cases, many of them will be asynchronous. We've learned a whole lot over the past year about what is best for students and enabling them to keep up with learning while at the same time do so in an effective way. And Zoom sessions are not always effective at all ages for all types of learning. Synchronous sessions will supplement where appropriate for older students, and the teacher will have a daily check-in with those students to ensure that they are able to get questions answered, know exactly what they need to do. In the middle and upper school, the grade level dean will, within 1 day of the beginning of that isolation or quarantine, have a shared Google document with input from each of the teachers that indicates the best way to continue learning for each class. For some of those classes, it'll be best that they just join a Zoom session for their class. For others, maybe, as we've learned, maybe it's not the best to be the one person who is in on Zoom while there's a good discussion going on, or for a lab or something like that. It might be better that they do asynchronous, in some cases. Either way, each of the middle and upper school teachers will schedule a time to check in over Zoom as well to answer questions and provide support. So the grade level deans and the teachers will be reaching out and ensuring that there's a solution that is customized to that student that, with some combination of Zoom and synchronous where appropriate, and then a combination of asynchronous as well to ensure that they're able to continue learning even if they have to quarantine or isolate. All right, and Jack, anything in closing before we go to some of the Q&A? Or let's jump right into the questions. All right, so if we go ahead into the questions, so we have a lot of questions out where we have some questions submitted ahead of time, a good amount that are there through the chat and Q&A. Thank you so much for reaching out with all of those. We'll work through a number of these. So one of the common questions centered around lower school lunch. about how exactly that will be carried out. There were questions about distancing in lower school lunch, about access to ventilation during lower school lunch, and also whether they will have access to the same, what will the food options, what will the food options look like? Will it be individual meals or back to the, COVID buffet, pre-COVID buffet type of thing?
Right, so I'll be happy to answer that question, Michael. So as Emily mentioned, we are planning to, particularly in the primary school and lower school lunches, limit the amount of time that they're in those spaces. So the upper school and the middle school have much larger lunch periods. The primary school and lower school are going to have condensed lunch periods so that the amounts of times that they're outside of their mask will be significantly reduced. We're also going to the best of our ability, try and keep it to one grade level at a time. So we won't have kids from every grade in the lunchroom at the same time. We'll have it much more narrowly cohorted. And then we are planning to go back to that full pre-COVID buffet. So students will be able to line up, go to the lunch line, choose what they want to eat from several different options. They will eat in the dining hall, but they will be distanced. So we're going to keep those kids distanced 6 feet apart.
And one came in, just adding to that on lower school lunch, it was about, can parents come to lunch in the lower school as they did previously?
At this point, we are not planning to have visitors to the lunchroom. We don't have the spacing to be able to keep everyone separated. We are excited about to have visitors back on campus, but at this point, we're not planning to have visitors for lunch. So we're going to keep those to the grade levels and the teachers.
And there were several questions around data sources and what types of things we look at as we are making these decisions. I know some of that was highlighted through the presentation, but because there were several questions around that, I thought it would be helpful for us to answer the question of what are the data sources that we look at as we're making these decisions? Is it exclusively based on what the CDC says? Is it, and then what type of data sources will we look at as we continue to consider these policies in the future?
Absolutely. So CDC is certainly one of the sources that we're using. We're also using data from lots of other state and national and international organizations to track data trends of what's happening in different locations. We are using a wide variety of primary research that's coming out. There are lots of studies that are coming out every week, so we're staying abreast of those. We're also following several epidemiologists, including Amber Schmidtke and Caitlin Jettelina, particularly with their experience as COVID data experts. So we have used that data. We're continuing to use it. Public Health England has been particularly helpful. They do regular technical briefings looking at hospitalizations, cases, secondary transmission, where are we likely to see that spread happening, and we'll continue to follow through with those.
And I just want to say we are looking at DPH case data and case data from the CDC and other sources on a daily basis. So we're also using the hospitalization data from the DPH, hospitalization and testing data from DPH and CDC as well.
There were Michael and Emily and Christy. There were questions about how do we know the percentage of kids 12 and older that have been vaccinated, because we haven't asked the parents for that. And I know there's a simple answer to that question.
Yeah, so we have asked the parents for that. So if you haven't uploaded your form to Walker Web, we would love to see it. We do have access to some immunization data to the state of Georgia, but if we would love to have students upload vaccination cards to the Walker Web, and we received even more over the weekend. So we are continuing as we get those vaccination cards to input that data into our data set.
There were also a couple of questions about some of the processes in the upper school, about whether students are using lockers and about how lunch will work for middle and upper school, where they're still eating in advisory. And so those are a couple of quick answers. Yes, students will be in middle and upper school will be using lockers. And also when it comes to lunch for middle and upper school, they will be utilizing the dining room, not eating in advisory. We're going to open up and ensure that as many students as possible are eating outside when it's possible, and encouraging that. We will be limiting the number of students at each table and spreading those out to decrease the volume of students that are in the dining hall on those days when they don't eat outside. As well, there are going to be in the middle school split more by group, by grade level, as they are eating lunch to decrease the sizes there. Another question that has come up is around when students are sick and you know the quarantining there. So and actually I will find that one in a second. Let me go to the next one. And I think some other question was, what were the key reasons that, you know, as the masking policy has now changed 7 through 12, there were questions of what were the key reasons or the key pieces of data that had the most influence in making that adjustment, you know, today.
So I would say, and Emily can jump in and whenever I misspeak, Emily can correct me. But I would say, as we were looking at it, some of the key pieces of data were Israel and the UK have really good data about Delta. And originally there was some discrepancy between the data from the UK and the data from Israel. And we're trying to get our arms around how those data points should influence us. We recently saw information where the data is looking more similar between those two countries, and that helped us to better understand how Delta might influence us here. I'll also say we spent some time over the weekend looking at case counts in schools that are near us, you know, Cherokee County, City of Marietta, Cobb County, Gwinnett County, a variety of schools who started school before us. We were looking at the case counts to get an understanding of the load inside the schools, particularly those middle school and upper schools, based on the experience that they'd already had. And, you know, we don't, like Emily said earlier, we all feel the same way. We don't want to have our kids in masks. We were really very hopeful that the case counts were going to be lower than they are now, you know, back in May, June, July, based on the vaccination levels we have here on campus. But at this point, it seems like, given the rapidly evolving information we have from Delta, and that the best scenario for our students from a safety standpoint is to have everyone being masked. We were heavily influenced by the transmission of Delta amongst vaccinated people, and then just the viral load. Emily?
I think the one thing that I would add to that is we've also been tracking pediatric hospitalization data, both nationally in Georgia as well as Region N. Since the beginning of July in our HHS region, which includes most of the states in the South, pediatric hospitalizations have increased by 500%. We know that in Metro Atlanta, our pediatric hospitals are at or near capacity. With their ICU, we've seen a steep increase in pediatric ER visits due to COVID, as well as pediatric hospitalizations due to COVID. So I think that has been an additional piece as well.
And I think maybe building upon that, another question, how do we square the advice that vaccines have been proven to be very effective against severe infection, hospitalizations, and death, while at the same time then having a highly vaccinated population then requiring the mask? So what are the other, you know, considerations, and how do we reconcile those two things?
Well, for me, one of the primary considerations is that we have said from the beginning of this pandemic that we want as many kids as we can have on campus every single day. And we don't want to have a lot of quarantines, and we don't want to have a lot of, we want to limit the contact tracing. We want to limit the number of quarantines. So even though we do have a tremendous percentage of our population vaccinated, to have the ability to mask everyone and be a little less focused on the 6 feet that you would need unmasked is just really nice to be able to limit those quarantines across campus. We've heard from schools, you know, to Michael's point earlier, as we look at these other school districts, we've heard of schools who started out fully mask optional, who within a couple of days on campus, a few days on campus, they were quarantining hundreds of people on their campuses. And that is not what we want for our Walker families. We want you to be able to have a place every single day that you can send your kids to school, and we want to be able to do it safely. So that is one of the things that's particularly important to us, is having the ability to have all of our kids on campus every day.
And then following up on that, how often will this policy be reconsidered? And there was another question that looked at what are the types of things we would be looking at as we decided, moving forward, whether to reconsider the masking policy.
So we plan to consider it on just on a regular recurring basis. We don't have a specific time set in mind. We're not going to say, you're not going to give you a specific date, but we are certainly looking at case counts. We're in the middle of a surge. When we look at particularly the pediatric activity, it's much higher than it was at this time last year, and even though we're in a surge then. So we're going to be looking a lot at the case counts, and then we're going to continue to learn more about Delta. So we can't give you an exact answer, but what we're going to tell you for sure is that we are going to continue to look at it. We're going to continue to try and learn more about Delta, to learn more about safety mitigation, and to find out even more information about the exact percentage of our faculty, staff, and students who are currently fully vaccinated.
Another quick one also is how do we define a low risk contact?
So the definition of a low risk contact, and some people may be confused because this isn't a term that you're going to see if you look on the CDC website, or if you look at the AAP. This is really a term that is unique to the DPH, and so that they have shared their definition of the low risk contact with us. And really it's a term that is a little frightening, but is really just to help you be informed. What we want more than anything else is for you to be informed about what happens with your child on a day in, day out basis. So it's just someone who's in the general vicinity of someone who tests positive, but they don't meet the close contact criteria. So, they may be across the classroom, fully masked for an hour, for an hour and a half, for some period of time, but they're in the general vicinity of someone who tests positive, and it would have to be within that 2 days prior to symptom onset, or during the 10 days that would be considered during the isolation period. So it's not a term that's used by CDC, so you may not have read it there, but it is something really, it's just a term used by DPH to keep parents informed.
So one of my jobs is to recognize and honor our time. We started at 3:30. We said we were going to go to 4:15. It's now 4:17. And I know there are questions that we have not been able to answer, and I know that we will do our best to try and answer those. And one of the questions I see coming up is, will the slides be posted online? And I'm going to say yes, and I see Christy nodding that they will be, and certainly will be available as well to answer questions along the way. I do think it's important to reemphasize that our first two core values are about the infinite worth and dignity of the individual, which really speaks to the health and safety side of things, and that that student learning is the chief priority of the school, which of course speak to the teaching and learning. And those really have been our guiding North Stars in all of this. And when I think back to March 2020, when we got started on all this, I know that there was a ton of uncertainty then. Most of us were probably scared, didn't know what was ahead. And now I think it's safe to say that we're all wishing this were behind us. And it's not. And I think most of us would like to never wear a mask again, but that's just not where we are. And so we're going to continue in the same way that we said in the beginning in March 2020. We're going to continue to go forward with grace and with empathy, because as Christy said, we want every student to be on campus, to be learning every day. That's one of our number one goals. But of course, we want them to be as safe as possible. And it's important, as the stewards of the children that you trust us with, to make sure that we're protecting the most vulnerable. And we feel like that's what we're trying to do right here. So thank you for joining us today. We look forward to continuing the conversation. Thank you for your questions. We'll be sure to address the ones that we haven't answered specifically, and feel free to follow up with any of us by email or by phone call or on campus. Thank you very much.